Good day guys, and welcome back to the channel. I've got a bit of a theme today, and no, it's not exactly being festive, but today I want to talk about circumcision. Okay, so essentially it's about getting that foreskin back, having some good health for your penis. Now, the circumcision is the surgical removal of the foreskin, that bit of extra stuff that covers the penis. Now, in this case, I'm not saying that I'm a dick, but I'll have to pretend to be one. And what we're going to look at are the reasons for circumcision and why it happens. Now, circumcision can be carried out for medical reasons as well as religious and cultural reasons. Now, mostly on the cultural side and religious side, it's removed when you're a child. So that's like, the Jewish community, Islamic community. Culturally, African communities carry out circumcision as well. Now, I am of African descent, but I am from the Caribbean. And I have had my foreskin removed, but it was for a medical reason, of which I will go into some of the medical reasons now. Now, you've got a condition where there's a tight foreskin. It's called phimosis. So this is where the foreskin is too tight and it can't be pulled back, okay, over the head of the penis. And this can sometimes cause pain and when the penis is erect, and in rare cases it can actually stop urine from coming out, and that is never going to be a good thing. Another reason for circumcision would be where the foreskin and the head of the penis become inflamed and infected. This is known as balanitis, sorry, my pronunciation. You also have one which is where the foreskin can't be returned after it's pulled back. So like in this case, let's say we pulled it back here, but then you couldn't get it back to where it should be. That's referred to as a paraphimosis, and it sometimes causes the head of the penis to become swollen and painful, and immediate treatment is needed to avoid serious complications such as restricted blood flow to the penis. And anytime there's restricted blood flow, we can think of atrophy or death of tissue. And no man wants to lose his Johnson. You also have other conditions. One is called balanitis exerotica obliterans. And I'm going to have to read this one because I'm not entirely sure about that. And that's a condition that causes phimosis, so that's the tightness of the foreskin, and in some cases also affects the head of the penis, which can become scarred and inflamed. Now, treatment-wise, for the, you have non-invasive and less risky treatments that could be tried, so use of local antiseptics and anesthetic gels, especially for like the paraphimosis where you could pull it back and you can't get it back to where it should be. You could use an anesthetic gel, so that'll help numb things, and you could try and pull the foreskin back. You have like anti-inflammatory, so just try and reduce the swelling as well. But overall, if you're considering circumcision, it's mostly for medical reasons, and it's good to discuss this with your doctor. Don't mean to sound condescending, but ask your doctor if circumcision is right for you. Alright, so you can have surgery, and it's usually day case, so you'll be in that day and you don't have to stay in overnight. You could have a general anesthetic, so you'll be asleep for the entire thing, or you could have a spinal, depending on your health. So you won't feel anything from the waist down, or maybe even a local, but I guess following discussions with your medical team will determine the right way for you to go. All right? So on that note, let's wrap it up here today. And if you're having trouble with this and getting it back, talk to your doctor and don't suffer in silence. All right? Remember, the entire purpose of this channel is to talk. If not with me, talk amongst someone else. So like, comment, and subscribe. And let's keep things moving along, guys. Penile health is a very important aspect for us men. And especially in this month of awareness for male cancers, make sure and keep checking your junk, guys, because we can stop people dying too young. All right, take care, guys.